Hey, what's up, Brotherhood? It's Kai here. I'm going to be filling in today. My hair's a mess because I just got off a plane, literally, and came to film this video. So, here we go. Today, it's going to be a little quick video, probably not edited very much, just so I can kind of get this up. But, I'm going to be talking about my top surgery a little bit. So, I got my top surgery back in May of 2016, so a little over a year ago. I got it with Dr. Raphael in Plano, Texas, and he actually does a procedure where they don't use drains. So, show my chest a little bit in the healing, and the lovely lighting from the windows making it. So this is what my chest looks like. Yeah. And as far as like the recovery process a little bit, I want to talk about. I made a pretty. There's more details on my whole top surgery journey and stuff. Like you can follow the whole thing on my personal channel, but I just wanted to put a little something here about it. So I want to talk a little bit about post-op depression and like the first few days after surgery, because that was definitely something I wasn't fully prepared for when I went into top surgery. Just the recovery process, like it wasn't something I had fully thought of. Like it's surgery, you think of that, but it's weird because it's a surgery I wanted so bad, and it was such a good thing for me. The last thing on my mind was the recovery days after. Even though I knew like recovering from a surgery, obviously it's not going to be a piece of cake. And I actually didn't take any painkillers after my surgery because it just really wasn't hurting that bad. Honestly, the biggest thing for me was just discomfort. I couldn't sleep on my stomach like I used to, like I always do. I couldn't sleep comfortably really at all. It was itchy. The bandages were itchy. Just changing them, just being nauseous the first few days. All that just really sucked. And not being able to do stuff by myself, relying on other people a lot to help me, relying on my mom a lot to help me get stuff, or take a shower and do all that was just really, really hard on me. And a big thing I said in my post-op depression video that's on my personal channel is the main thing that helped me get through the post-op depression period was just telling myself that each day, each minute even, I'm getting a little bit better. I'm healing up a little bit more, and I'm getting a little bit closer to the day when I can take off the bandages, when I can sleep comfortably again, when I can go and walk around like this outside. I mean, at this point, I've been to the beach, I've been to the pool. I barely ever wear a shirt in the house, honestly. Uh, yeah, it's been really, really great, and it's really, really, it can be really, really rough at first, but it's just important to keep reminding yourself that each day you're getting a little bit better, each minute you're getting a little bit better, and that really, really helped me push through. And before I knew it, really, not before I knew it, like those days lasted a long time, but looking back, they didn't. In the moment, they lasted forever, it felt like, but looking back, they really went by fast, and I'm here at this point where I am today, and this is my chest, and life, you know, comfortability in my own body and my own skin and just walking around and all that has improved so much. It was definitely worth it, worth the discomfort, worth the pain. But the big thing that really gets a lot of people with my surgeon and my surgery is just the fact that he doesn't use drains. So I never had that drain experience. I've heard drains suck and are annoying and gross and all that, and I'm very glad that I didn't have to do drains. It was really just by chance. He happened to be the surgeon close to us, and then after looking him up and stuff, we really liked him, and he just happened to not do drains. So that wasn't something we even knew was possible or we were looking for. It just kind of happened that way, but I'm super, super grateful and thankful it did, and I had a pretty good recovery, honestly. It was rough, it was hard, but I didn't take my painkillers. I didn't need to take my painkillers. And overall, like the scars healed up really great. I used Scaraway gel. First, I used this little gel that came in this little tube, and then I used like this one that you roll on. So those were the same brand Scaraway, and that's all I used on my chest for maybe 3-4 months on my scars, and that's how that happened. So as far as like feeling goes, my nipples my nipples are definitely not as sensitive as they used to be, not even close to as sensitive as they used to be. It's hard to tell, honestly, fully 100% if I'm feeling stuff or if I just, because unless I touch it with something else, I can feel it on my fingers, obviously. So there's minimal feeling, and that is what it is. I would have preferred to not lose feeling, obviously, but it's not something that like affects my day-to-day life or something I even think about a lot of the time or really ever much. So it's not a huge deal. Some people don't even get nipples at all. But yeah, that's just a little bit about my top surgery, because I don't think I've really talked about my top surgery and all that, and my surgeon and all that stuff on this channel, ever. So yeah. All right, guys. Thank you for watching. I will talk to you all soon. Stay strong, stay safe, stay you. Peace.